So really the goal of this study was to try to understand the diversity that exists within lung cancer. So lung cancer may be thought of as a unified disease, but actually within this one disease there are many subtypes, and there's a lot of diversity in terms of the molecular landscape that can be defined within lung cancer. And so what we did in this study was to take molecular data and analyze the data from a large set of lung cancers, and to use this to be able to break down the set of over 1,000 lung cancers that we studied into distinct subtypes on the basis of their molecular profile. So from this large set of lung cancers, we could break down into distinct subtypes that were very different on the basis of what kind of molecular aberrations they showed, what kind of pathways they had turned on or turned off, and what therapies might be best applied to different cancer subsets. And so it's so maybe in the clinical setting, many of these cancers are thought to behave the same way, but in fact we apply molecular tools in analyzing these different lung cancers. We find that there's not just one type of lung cancer, but in fact there's many diverse types, each with its own behavior and different outcomes. The challenge with the molecular therapies in cancer is that if we treat all patients the same way, we find that not all of them will respond, and so it's not clear, which subsets of patients. There's a lot of questions in the scientific community in terms of what molecular variables need to be measured in order to best know which patients should get which therapy. So that's something that our study set out to do in terms of not just defining the subtypes, but then trying to understand the therapeutic implications for each subtype, trying to understand what therapies might be best tailored to that subset. And in fact, we found that I think for most every subset that we define, that there would be some therapy out there that would be in clinical use that in theory could be used to target that specific subset.